What is the common myth that a clinician believes about leadership?
A leader needs to know everything. I think that's the myth that is not true.
What does clinical leadership mean to you in the context of MSK care?
A multidisciplinary approach to patient care had better results, had fantastic results, in fact.
Welcome, everyone. Welcome to another episode on Priya Physio's podcast. And today we are going to focus on clinical leadership. As you all know, when it comes to leadership in physiotherapy, there are four major pathways: clinical, non clinical, or your healthcare management pathway, academics or research, and finally, your private or your entrepreneurship. So, today's podcast is going to focus more on clinical leadership and how you can transition from a clinician to an educator to an entrepreneur. You will be listening to the leaders in MSK clinical practice, which is musculoskeletal clinical practice. I have two guests today on this podcast: Carl Clifford, who is a co director of Simply MSK, which is MSK education provider, and he's a highly specialist physiotherapist. He is also an advanced practice physiotherapist who works in the NHS and private sector. Carl has keen interest in lower limb pathologies, including ACL injuries and Achilles tendon injuries. I have a second guest on this podcast today who is Dr. Alastair Jones, who is a co director of Simply MSK Project, the MSK education platform, and he's also a sports medicine doctor. Alastair works in the NHS and private sector in MSK and sports medicine. He has worked extensively in rugby and netball, both nationally and internationally. Thank you so much for coming and agreeing to be on this podcast. It is just so good to have two experts on such a lovely evening where we'll be sharing insights with our fellow physios and other healthcare professionals who are interested in MSK and sports.
Yes, sure, no problem. Priya, thank you for having us again. So, yeah, we're really happy to get on this podcast and kind of talk all things leadership. So, as you've already alluded to, my name's Carl Clifford. I'm a clinical specialist MSK physiotherapist. I'm predominantly with the lower limb, and more specifically, more recently with knees. So I'm kind of working in an orthopedic knee clinic with four orthopedic surgeons out of Chapel Allerton Hospital, which is based in Leeds. And I also, as you've already alluded to, run and I'm a co-director of Simply MSK Limited, which is an educational platform that looks after MSK clinicians throughout the MDT to support them and guide them on their MSK journey. And then additionally to that, I also work in the private sector. I work for CSPC Physiotherapy, which is also based in Leeds. That's under Alison Rose, who is one of the Olympian physiotherapists. So she's a fantastic mentor for me, and it's been fantastic working there. So so I'm quite busy. As we were just talking before the show with Priya, it's I have two young girls, so kind of balancing effectively four jobs can be quite challenging, but it's certainly rewarding. So that's essentially me in a nutshell.
Thank you so much, Carl. Thank you so much. As I said earlier, your plate is like really, really full, especially with two little girls and managing three different projects at work. Amazing. Thank you so much for being here. Now, over to you, Dr. Alastair Jones. Can you please give us a slightly detailed introduction of yours and who you are as a person, and why should anyone watch this podcast today?
Okay, so thanks very much, Brindy, for having myself and Carl on. So I'm Alastair, father of two, first and foremost. I am a sports medicine, sports exercise and musculoskeletal physician. Initially started out life as an emergency medicine consultant, but sort of transferred across over the last sort of 10 years into more sports and exercise and musculoskeletal medicine. I work in the NHS, where I founded and I work in a acute musculoskeletal service looking at soft tissue injuries from an acute nature. I also work privately in a couple of clinics in Leeds, the Nuffield and the Yorkshire Clinic, again, seeing a range of musculoskeletal conditions, from your weekend warriors all the way up to your elite athletes. I co-direct Simply MSK, along with Carl and three of our other colleagues. I also am a co-founder and co-director of a company called eCovery, which is an MSK digital triage platform. And I work still in elite sport, this time, as you alluded to, with the Leeds Rhinos netball, formerly with their rugby team for many years. So it's, as a lot of us MSK sports medicine docs / physios, we have a few hats, but it keeps it varied, keeps it really interesting. Yeah, that would be me in a nutshell.
Wow. Wow. Amazing portfolio, Dr. Jones. This was incredible. I mean, working in all these sectors and similar to Carl, it is difficult to manage all these hats, having kids and everything else. And today's topic is leadership. My aim is to empower physios to pursue leadership roles. Now, leadership doesn't come with title. You would all agree with that. Leadership is you start leading at where you are, no matter what job role you're doing, what you're doing personally, what you do professionally. It is about who you present yourself when you're talking to people, when you're interacting with people, especially in the healthcare, where every person who comes to see us depends on us. And they're looking up to us to give them the answers to their worries, their concerns, and their physical health problems. And that's why we are doing this podcast today. So let's start with at the top, right? Let's talk a little bit about Simply MSK and where did this idea begin?
Yeah, I'll take that one then. So Simply MSK, the idea interestingly came from a train journey that myself and Alastair was on, all the way from Leeds down to Brighton. We were heading to the British Association of Sports and Exercise Medicine conference at the time, and having worked with Alastair in the MSK clinics in Bradford for a number of years up to this point, I kind of noticed, and in fact we both noticed that having a multidisciplinary approach to patient care had better results, had fantastic results, in fact. We were finding that having, physios, sports medicine physicians, we had radiologists, we had sonographers, we had the orthopedic surgeons, we had emergency nurse practitioners, all kind of working in harmony together to manage these acute MSK conditions to kind of get them through the full journey and get them back to their normal activities. So I had this idea that, having seen all this happening in real time, that from a education perspective, as a physiotherapist, and this is me speaking as a physio, that I didn't particularly feel that there was that appreciation for the multidisciplinary team when I was going on a lot of the physiotherapy courses. Now, I'm not going to sit here and say that the physiotherapy courses were not good, because they were. There was some very good courses out there, but it didn't really lend itself to that multidisciplinary approach to get the best out of that patient's journey. And when I was speaking to a number of physios, junior to me, that they all felt the same in the sense that the silo working wasn't really giving him that thorough understanding of different disciplines and different roles within MSK. So I had the idea prior to this train journey, and I thought, well, this is a good opportunity to sort of sell it to Al. And knowing Al and who he is, if it was a bad idea, he would have simply shut it down. So I pitched the idea to him, and to my pleasant surprise, he was very much on board with the idea, and he felt there was certainly had legs. So when we then took it back to where we often met at a local pub called the Cavalier Arms. I'm going to give it a shout out now in the hope that we'll get a free meal out of it. Um, so we used to meet there. Myself, Alistair. There was another sports medicine physician called Dr. Michael Cook, and there was Damien Buck at the time, who was another physiotherapist, and we often met at the Cavalier Arms. And at this particular point, we thought, well, let's just pitch it to them. Let's see if they feel that this is a good idea. So we did, and we thought, well, actually, let's give it a try. Let's trial run this idea. So a few months later, we set up our first evening talk, evening event, and we put it out as a free event just to see if anybody would be interested. And we set it up at a small football club. It was a small venue, but it held a reasonable number, and we sold it out. Uh, we sold it out, which we were absolutely amazed by, obviously in a positive way. And from that moment, really, we kind of thought this is an idea that people are interested with, and this is what people want to really learn from and get this multidisciplinary approach out there. And we know that there's evidence behind how good the multidisciplinary approach is. You know, I'm gonna give myself a bit of a plug here. As part of my dissertation when I did my MSc in Bradford University, which was part of the MSK Physiotherapy MSc, I looked at a service evaluation of an acute knee clinic and how that would impact its effectiveness and how that would impact on reducing delay to ACL injury. And on the back of that study, we found that the delay from what we would class as a standard A&E pathway, which was the pathway that was in play before this acute knee clinic was established. There was a 97-day delay before an ACL was diagnosed. Whereas when we set up the acute knee clinic, we found that that delay had reduced significantly to 2 weeks. So within 2 weeks, we had a diagnosis of an ACL injury. So it kind of goes some way to show and demonstrate that a multidisciplinary approach is a better way of working. And I appreciate that's only one particular example on a particular ligamentous injury of the knee, but I'm sure I will allude to later and talk about a bit more with the knee clinic with the acute MSK clinics, is that we've got other investigations and other studies ongoing as well that will hopefully show the same. So yeah, so it's that's where the idea came from. Essentially, we pitched it to our team, and we were all keen to get it going and get the idea out there.
Amazing, amazing. Thank you so much, Carl. And throughout, when you were talking, I was even writing down some notes and noting some points down. So, to all our viewers and listeners today, it is so important how you act upon the ideas that you get. A normal human brain gets up to 60 to 70,000 thoughts per day on an average. Of those thoughts, one idea like this could materialize into a limited company. Who would have believed that a journey, we have several journeys when we are commuting to conferences, work, anywhere we meet people, we talk to our colleagues, and we discuss so many ideas, but bringing that idea into practice and seeing it flourish is like a dream come true. Well done, Carl, and well done, Dr. Jones, for getting this idea out of your minds and onto a real platform. How great is that achievement? And also, one thing that comes to my mind, you are the reflection of top 5 people you spend time with. This is a complete, a complete full real life example of what that means. Carl spending time with Dr. Jones and spending time with all your colleagues who are out there. It's just like great minds think alike. And that's why this idea came into reality, is how I see it. Thank you so much for giving us a detailed backstory of Simply MSK. So now over to you, Dr. Jones. Let's talk a little bit about clinical leadership and what it looks like today. What does clinical leadership mean to you in the context of MSK care?
Sure. Okay. So the multidisciplinary working that Carl has just talked about, I think is really important. The patient satisfaction surveys that we've conducted through various channels have always been positive, and mainly the comments have centered around, we enjoyed seeing a clinician with a physio, with a sports therapist, whoever it might else be, at the same time. So, of course, when you have multiple people contributing to a service, then you need some framework whereby there is leadership, whilst also being respectful of everybody's views. There are lots of ways to lead, and Priya, I'm sure you can sort of teach us a few things about that. And so initially, if we go back to simply MSK, Carl had the idea, and we talked about it on that train journey, and then we brought in two and now three very senior colleagues. So there's not necessarily one absolute leader there, but someone has to take the role of keeping everybody else on track. Great minds, of which Carl, Damien, Michael, and Matt are, often can go off on tangents and all with really relevant points, but we can't do it all at once. So you need that one person, I think, to bring everyone back into line based on the plans that maybe you've put down initially. But you have to do it in a really respectful way. So there are different ways of leading. The leadership in Simply MSK is around letting everybody have their voice and then coming to a collective agreement, as opposed to one person at the top dictating down. And that's how I think multidisciplinary care works as well. There's many documented stories of more senior people not caring what more junior people think, or perhaps not listening to them, and then problems have arisen. So letting everybody have voice, but then that overall, let's keep on this path, I think is where I would say clinical leadership is certainly how I like to do it.
Thank you so much. Thank you. That's interesting because I think whenever we talk about a multidisciplinary team, automatically we tend to see the person who has the most degrees or experience is a leader. For example, if it was a team of doctors, nurses, physios, OTs, we would automatically give that leadership title to the doctor and we will look up to him to then guide everyone else in the MDT. But what you're just saying is it depends on the situation that you are in, and everyone has to take their own leadership roles depending on what you're doing for the patient for that particular project. And that's exactly where this the sayings comes from. Too many cooks can spoil the dish. But then, as you said, if you understand where you should be stopping and drawing a line and where somebody else should be picking that up, is exactly what's needed in an MDT setting when it comes to leadership. And that's why we say it's leadership for all and leadership without title. Thank you so much. So, just between the both of you, one question, okay, or maybe one myth from each one of you. What is the common myth that a clinician believes about leadership? So, let's go to Carl first.
I think you've kind of already alluded to probably the biggest one there, really, in what you just said, in that 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 person in a management role, or in a higher perceived role, like as a physician or a consultant, that kind of that's what ultimately people think is what leadership is, and that's what the only people who can lead are the ones who are in those roles. But as you've already said, it's anybody can be a leader. Particularly if you have somebody in your charge, if you're guiding and supporting somebody, whether that be a brand new qualified physiotherapist who's been provided a student to support, or a therapy assistant, you are effectively a leader straight off the bat. You are a leader, but how you lead is where the skill comes from. And that's where, listening to podcasts like this and learning from esteemed colleagues and people who have been through and have experienced being leaders, that's where you learn, isn't it? That's where you strive and become a better leader yourself.
Exactly.
So that
Thank
would
you
be
so
my
much.
myth.
Thank you. Dr. Jones?
Yes, so my myth's simple. A leader needs to know everything. I think that's the myth that is not true. I think that the great leaders, when you look around the world of sport or business or wherever you want to look, are ones that are constantly learning and humble enough to realise that they know possibly less than the people that they are due to be leading. I always quote, I believe Steve Jobs said this, might be, forgive me if I'm wrong, but he said, why would I hire experts if I then tell them what to do? I'm hiring experts so they can tell me what to do. So you don't need to know everything.
Exactly, exactly. Amazing. That was interesting. So a leader doesn't need to know all. To all the viewers, a leader doesn't need to have all the answers. A leader should know how to facilitate something under their project when it comes to leadership. And one more thing, which Dr. Jones mentioned just now, was lifelong learning. The moment you stop learning is the moment you die. This is what Mahatma Gandhi quoted. Okay. And that's why you would rather continue learning throughout your life. The moment you stop learning, you stop growing. That's how we take it. Thank you so much. That was wonderful. So, we've talked a lot about collaboration and effective leadership and clinical leadership. Just coming back to some practical tools or communication habits which help teams collaborate better. Do you have any that you can share with our viewers today?
Probably the tools that you want to be utilizing in a leadership role. You're kind of looking at, so certainly keeping in touch with colleagues and people who you would see as a positive leader. I think that's definitely a good thing to be putting into practice.
Thank you so much. Dr. Jones, would you like to add anything?
So, in tools that make a good leader, I think again, just listening and always being receptive to new ideas, always being mindful of listening and taking other people's perspectives on board.
Thank you so much. Thanks a lot. Now, moving on to one thing, okay, one thing that clinicians can do this week to improve their leadership within their teams.
What I would suggest that they do straight off the bat, and this can be for any clinician at any level, and any member of the MDT, not just physios. There is something called a 360 questionnaire that people may be familiar with that you can access.
Mhm.
And I think what that does is it enables you to get that baseline of where you and your team or the people who are in your care or who you're supporting, what their feedback to you is, because sometimes as a clinician and as a leader, you don't always know exactly what you're doing wrong if you are doing something wrong, and you don't always know what you're doing right, and it might be that you need a little bit of feedback from your colleagues and from your teammates just to get a bit of an idea and a bit of a baseline of where you're at. And I think once you have that baseline, it's then a matter of making that one positive step and trying to stick to that step for approximately 3 months to make it a habit. So I think that's probably the best bit of advice I can give to people listening to this podcast to start off in terms of becoming a better leader.
Thank you so much, Carl. That's interesting. So 360-degree feedback, okay? And share it with at least 10 colleagues and see what you get back. And colleagues from uh, different parts, for example, your friends, your peers, your juniors, your support workers, your patients, families, carers, if you work closely with them. So it should be from everywhere. And that's when you actually get to know how you interact with different people. And moving on to Dr. Jones, anything from your side that you suggest our viewers today?
Yeah, so I'm a big believer in starting and doing something. Not everything you start and do will work. So you mentioned at the beginning that you have 60 to 70,000 thoughts a day. I didn't know that. That's good. It's a piece of learning I'm going to take away. And simply MSK was one of those thoughts, and that flourished into what it is now, and hopefully will grow. And it happened because we did something. We organised a course, and we had no idea if that would work, but we did. And so I would say if you're starting off in leadership, generally you're starting off from a more junior position. And so maybe going to a more senior colleague and asking for a project. Asking, say, can I lead on maybe a guideline development, let's say, or a pathway or a protocol? And you lead on that. And what that's going to teach you is it's going to teach you how to write that pathway, that protocol. It's going to make you better at that certain condition that perhaps you're writing the pathway about. But it's also going to get you better at communicating and working with other people who you'll undoubtedly have to collaborate with. So start small and do something. And you will make lots of mistakes, but you'll learn from those. And then you will move on to bigger and better projects and eventually be put in charge of bigger, better teams. And that's how I think what I would say is a good way of starting, good tool.
Amazing, amazing. Robin Sharma always says that have a spectacular failure. Don't be afraid of failures. Whatever you have in your mind, just try to implement it. And one more thing that I would like to everyone to know, that you never get rewarded for races you never finish. You start a race, you go up to the finish line. That's when it's accomplished. Even if it's a failure, that's fine, but at least you completed it. That's exactly what Dr. Jones is trying to say. So let's move on. Now, this is getting more interesting because I'm talking to two clinicians. Okay. I'm a clinician myself. But from a clinician to an educator to an entrepreneur, how does it feel like? It doesn't sound small. It's a big deal. What was that transition like for you? And are you still navigating that transition? And how long do you think it ideally would take for someone to have changed that mindset from clinician to educator to entrepreneur and then balance everything? Over to you, Carl.
Yeah, so it's a very big question, isn't it? So it's yeah, to become an educator, to become an entrepreneur, I think it's something that really excited me personally, to be honest. Even from being a relatively junior clinician, it was something that I kind of always, I think it was always a bit of a bug inside me, really, that I always wanted to kind of educate. I always wanted to kind of start up something new and start up something for myself. So, I mean, the transitions, I'm not going to sit here and lie and say, oh, it was a dead easy thing. It's ultimately, it's a challenge. It is a challenge, but it's a different challenge. And you kind of have to have that sort of resilience that comes along with it, because you definitely get knockbacks along the way. Alastair was alluding to one earlier on in terms of, we go through these experiences where we obviously do really well with we've done really well with our first few talks, and then as soon as you get to a stage where things don't go as much to plan, then you kind of you have to learn from it, and you have to be resilient to be able to move forward. So yeah, the transition, it's an ongoing process, again, as you alluded to, because I'm still a clinician most of the time in the week, and my I've got members of the physiotherapy team and the orthopedic team who are within my kind of leadership scope, and I guide them. So I'm effectively educating every time I'm having conversations with them about patient and clinical reasoning sessions. So it's an ongoing thing, and certainly for me personally as well. I also got into the fact of educating and setting up this business more, well, not just for obviously educating colleagues and clinicians, but it was also for myself, because I wanted to kind of make myself learn and force myself to kind of keep moving forwards and growing, because it's easy just to sit in the role that you're in and just stagnate. But I wanted to move forwards. So I think that drive has always been in me. And then, we've already talked about it a little bit, but once you get that idea that you feel that has legs, and we've trialed it and it worked, then there's every chance that you can keep moving forwards with that. And we really want Simply MSK to work, and we really have a strong vision for where it's going to go moving forwards. And we're really confident in the content and the ideas that we've got over the coming years. And I'm sure Alistair will attest to that.
Thank
Yes, so I think that's where where I'm at with that.
Thank you so much. You said a very beautiful thing. You said you don't need or you don't have to wait for X amount of years of experience to be able to implement an idea. You have an idea, you want to implement it with full heart, just go for it and do it. And just see what comes out of it, is what you're saying. Coming to you, Dr. Jones, you're double hatting when it comes to clinician, educator, and entrepreneur. You are a co-director in Simply MSK. You're also a co-director in recovery. So how does that work for you? Because it's not easy handling one project as your business. How does it feel like controlling two and then having your day job as well?
When you sort of say it in sort of list all the jobs in a row and stuff, it does sound like there's a lot, but obviously you can only do one thing at one time. So focusing on the job that you're doing, and putting your effort into that. So for example, tonight I'm doing a podcast with you, and that's where my attention is. I'm not thinking about recovery. I'm not thinking about simply MSK more than the conversation tonight. The transition between clinician to educator to entrepreneur, and then how do you wear those hats, it was just quite a natural progression, really. I mean, I started as a clinician because that's what all doctors do, and I didn't really know much when I graduated from medical school, and then you learn a lot more over the last sort of, I don't know how many years it is now, a lot, 20 odd years. And then as you sort of get more experienced, you're asked to teach. So that transition into education is a fairly natural one. And I think then you start to do more clinically and more from an educational perspective, and you notice gaps and holes and things that aren't working as well as maybe they should. And that's where the entrepreneur hat comes on. And so we noticed gaps in musculoskeletal education, or at least something we think we could do slightly different. So that's how that developed. For recovery, it was trying to get the right patient in front of the right clinician at the right time. And that sounds very intuitive, but it doesn't happen all the time. And so we put our heads together, myself and the other co-founders, and worked out tried to work out a way of improving that. And it all came from just simply sitting in clinical practice or talking to people through education, noticing gaps and trying to act on them. So I don't wear all the hats at the same time. What I try and do, and it doesn't always work, is focus on what I'm doing. So tomorrow I'm in clinic and I'll be giving the patients 100% of the attention. And then in the evening, there'll be lots of emails and WhatsApps that have come through that I'll try and look at and maybe put the other hats on. So that's how I do it anyway.
Thank you so much. Thank you. That's incredible. So, everyone, just to summarize what Dr. Jones said, you have to focus on that one thing at any one time because you cannot be doing two, three different things. So, you focus on one thing and it gets done. If you try to do two or three things at the same time, nothing gets done. So, that is our takeaway for tonight. Number one, what Carl said, don't wait for experience. If you have an idea, implement it. And what Dr. Jones has just said, focus on one activity, one task at any one time. Thank you so much. Now, what advice? You've given this advice already, but if somebody, a physio, more towards Carl, if a physio wants to influence beyond the clinic, what advice would you give them, Carl? So, would you think about education, digital health, service redesign? What do you think that they need to think beyond their day-to-day clinical practice?
It's one of those where it's what where does your interest lie? So if you're somebody who likes being online and being on social media, and you feel confident in yourself to be putting videos out of maybe, doing certain exercises, rehab exercises for certain conditions, etc., which you do see a lot of that on Instagram and Twitter, Facebook, etc. Then absolutely, if you go and do it, go out and do it and see where it takes you. There's lots of people who want to go down the line of influencing, and they're happy to get hundreds of thousands of followers on Instagram and Twitter and that's absolutely fine. But it's also fine to not want to do that, and there's other options, there's other directions you can go down as well. For me personally, it was more down the line of looking at the service pathways and looking at how I could implement change within the departments that I've worked in. So what I wanted to do is always make sure that the departments were evidence-based. So I looked at the protocols and processes and pathways, and they were the kind of the routes that I went down. Again, nobody asked me to do this. This was because I had a passion, and I had a passion for MSK. I wanted things to be better, and effectively I wanted my life to be easier because I wanted to be able to learn how to give the best quality of care to the patients. So yeah, we've already kind of touched on the fact that moving forward, the establishment now of AI, it's getting more and more advanced as time's going on. Things like ChatGPT, etc., are becoming more and more prevalent within practice. But we shouldn't necessarily be scared of artificial intelligence. I think what we need to do is look to see how we can utilize it as a tool. and see again, linking back to pathways, back to, you know, what we've talked about with get social media enhancements and things like that. We want to kind of see where we can introduce artificial intelligence within our pathways and within leadership.
Thank you. Thank you. So what you just said, which caught my attention, was don't be scared of AI. Okay. It's a tool that is human made. We've made it. Okay. And now is the time that instead of feeling scared of AI, feel more human. Because eventually, the way IQ used to work years ago, where people used to be tested based on their IQ, intelligence quotient, now it is emotional intelligence, so EQ, which makes you more human. There is SQ, which is spiritual quotient. So you've got to bring all those human elements in. And you mentioned about resilience as well, which is adaptability quotient. Okay. So how can you showcase your EQ, SQ, and AQ is what will make you more human. And that's how you can actually then go into any sector that you want to lead in, like influencing. And what Carl says is right, but then all the physios or all the clinicians who are out there, if you're influencing, make sure it's evidence based. Don't influence for the sake of influencing and followers. Thank you, Carl. Now, moving to Dr. Jones, right? Let's talk a little bit about the future of MSK leadership. Okay. We've spoken about leadership in an MDT setting, and you know that MSK care is evolving fast. There is new technology, new evidence, new pathways. What kind of leadership do we actually need considering all these new evidences, technologies that we are getting? And what risks do we face if we don't empower clinicians to lead at a system level?
Yeah, no, there's a lot of things to sort of think about there. I'm going to go back initially to what you just said, summarizing Carl's last piece. Different quotients, the intelligence, the emotional, spiritual, adaptability. For me, the biggest cue a leader needs is EQ. You don't need, like we've said before, to know everything. You don't need to be the most intelligent, but you need to be able to feed off your team and what other people are telling you, both in a positive way, but also a way when you know it's not the right thing to do. And how do you handle that? So the future of MSK care and leadership, we talked about AI, we've talked about different therapists, different doctors. Now, MSK medicine is becoming more and more popular, more and more talked about. So it's about trying to make sure that all those voices are heard, making sure that they all get representation, and with a big EQ, making sure that the leaders bring everyone in. So I think that's one of the biggest challenges that I think we face now in MSK leadership, and what we need to have. We need to have really empathetic leaders at the top who are making sure that all these new technologies are brought in time, and making sure we have the right people in place to be able to deliver them successfully. So I think that's probably where it's going now. We've just over the last few months, I'm sure some of your listeners will know that the BASM and the FSEM are joining forces. So the Faculty of Sports and Exercise Medicine and the British Association of Sports and Exercise Medicine are joining forces, which has been something that hasn't happened for lots and lots of years. They now are, and they're going to form their single college. And that's a wonderful move, that, because it's shown that people are coming together now, wanting to lead as a joint unit, and that's far stronger than if you are trying to do everything on your own. So empathetic leaders that bring people together, I would say.
Thank you so much. To all the listeners and all the viewers, if you're ready to be part of the next generation of MSK leaders, explore Simply MSK's clinical mentoring and advanced courses at simplymsk.com. The link will be in the description. So go and see what suits you and what you would like to learn, because gone are the days that people were scared of going into niche areas. Now is the time that you move yourself from a generalist area to a specialist one. And with the team that Simply MSK have, we have lower limb specialists, we have upper limb specialists, we have sports medicine experts like Dr. Jones, and there is a whole team which will cover most of the body. And if you are interested in that, please go and visit simplymsk.com. Now, finally, this is the final segment of the podcast, and it's called a quick fire round. Okay. So it's leadership in action. Let me start. I'll go with Carl first, and then come to Dr. Jones.
Okay, so I would say another myth with regards to leadership would be around the sense that you have to be an extrovert to be a leader. So I would strongly disagree with that and say that you can be either an extrovert or introvert to be a good leader
Thank you.
for all the reasons we've just talked about.
Thank you so much. Dr. Jones, please. One leadership myth.
Okay, so before I said that you have to know everything. That's definitely not what you need to. You don't need to know everything, and I'm going to stick with that. That is a leadership myth to bust. Be comfortable not knowing everything.
Thank you so much. And one leadership trait that's underrated in healthcare. Carl, please.
The one underrated one would be quite simply saying thank you. It's such a big thing that is often not done, and just showing that person gratitude and value, that they're valued by yourself.
Okay, Dr. Jones, please.
Communication. We talk about it a lot. It's often done really poorly. I would say an underrated trait, communication.
Thank you. One mistake you've learned the most from, Carl?
So that would be more as a junior clinician, when I used to rush through the subjective assessment to get straight to do all these fancy special tests that we now know are not that special, and ultimately rejecting the therapeutic alliance. So now I'm more experienced. I know that the importance of a good subjective assessment to get that therapeutic alliance is incredibly important.
Thank you. Dr. Jones?
Trying to build too quickly. It takes time to build whatever you're doing, whether it be your clinical practice, your education, entrepreneur. So have the idea and build slow and steady.
Thank you. One daily habit that helps you lead better. Carl?
Have a good morning routine, I would say. So when your alarm goes, get up straight away. And one thing that I do is I show gratitude to the people that I care.
So I would say, yeah, something my grandma told me, which was never put off a task that can be done today for tomorrow.
Amazing. Thank you. One book, podcast, or resource every MSK clinician should check out.
So that would be The Leaders Eat Last podcast by Simon Sinek. Fantastic book. Definitely worth a listen as an audiobook or as a read. And I've learned loads from that. So I would definitely recommend that one.
Thank you. Dr. Jones?
My resource is always my friends and my family. I don't have a specific book or podcast. I learn a lot every day from my children and my family. So I would say my wider friend group, I learn all the time.
Thank you. Thank you. And last one is one thing you'd say to a clinical physio who doesn't feel ready to lead.
I would say that if you've got someone in your charge, that you're already in a leadership position. So it's then questioning yourself and reflecting on what type of clinician and what type of leader that you want to be. So I would get them to do, again, as we talked about earlier, the 360, and then get them to understand where they're currently at and where they need to improve.
Thank you. Dr. Jones?
I would say to someone who doesn't feel ready to lead, start. Do something small, jump in, do it. You have to believe in yourself to make it work, and then you'll grow from there.
Thank you. And any final messages to our viewers? How can they find you? Where can they find you? Not just simply MSK, but where can they find you if they want to reach out on a personal level?
Yep, so probably the easiest place to find me would be either on Instagram under the bracket of the knee phys, or the knee underscore phys, or on LinkedIn, which I'm relatively active on LinkedIn as well.
Thank you. So I'll put the links in the description for all the viewers. If you want to find Carl Clifford, I'll put the links and his social media handle so you can get in touch with him. Dr. Jones, please.
Yeah, two areas for me. So my website, thesportsinjurydoctor.com, and my LinkedIn page. Alastair Jones.
Thank you so much. And those links will be in the description as well. Thank you so much, both Carl Clifford and Dr. Alastair Jones, for being on this podcast and for sharing your knowledge, your wisdom, and your ups and downs from in your journey from a clinician to educator to an entrepreneur. So to all the viewers who've seen this podcast, give us a like and share with a colleague who needs to listen to this. Thank you so much. It was lovely hosting Carl and Dr. Jones on this podcast. Thank you.